Today I'm going to talk about something called adjustment disorder, also known as situational depression. Situational depression is characterized by an excessively negative reaction to an identifiable life event called a stressor for a period of up to 6 months. Now, what makes this a disorder and why it's considered an abnormal health risk is because the physiological and psychological effects of the reaction cause significant suffering and impairment in one's social, occupational, and academic life. The effects are grouped into subcategories of the disorder, so we can talk about adjustment disorder that presents as mostly depression or anxiety or even reckless and rebellious behavior. This is because people deal with traumatic stress differently. When the disorder presents with depression, the person may suffer a depressed mood, feelings of hopelessness, crying, fatigue, and suicidal ideation. When it presents with more of an anxiety subcategory, there might be some of those symptoms too, and the person might have difficulty concentrating and find themselves withdrawing from things that they once enjoyed. Negative changes in personal conduct involves a person actually breaking rules and laws and having a lower regard for other people's rights. Violating social norms becomes an unhealthy outlet, and this stems from the complex feelings that the person has surrounding the stressor incident. And as stated, all people are different. So a person's temperament, past life experiences, feelings of vulnerability, coping skills, and economic situation all contribute to the level of adaptability to the stressful event and being able to move past it. As stated, all people are different. People will have different life experiences and feelings of vulnerability, coping skills, levels of resiliency, and economic situation. So all of these factors contribute to their level of adaptability and being able to move past the stressor event. What exactly do stressors look like? Pretty much anything. Earthquakes, fires and floods, traffic accidents, divorce or parental conflict, moving to a new school, moving to a new city, changing cultures entirely. Culture shock is a form of adjustment disorder sometimes. It's important to remember that stressors are subjective. Any serious life event that causes enough of a negative impact on someone can be traumatizing. It might not be that big of a deal to you, but you're in a different situation and a different mental space. So the severity is real in its consequences and how it manifests for that person. And how is this diagnosed? The process is as follows. A psychiatrist or a mental health professional gives an interview to the person suffering and their family, just depending on the age of the person, because it's important to know things like their past history of development, how they've responded emotionally in the past, any serious life events other than the stressor event, and then the stressor event itself. Resources and social supports that can help include different kinds of therapy, like family therapy, group therapy, or individual therapy, different kinds. Like psychotherapy can be helpful. Behavior therapy, and there's many self-help options as well. What about medications? Because adjustment disorder is considered to be a short-term maladaptation to a stressor that resolves within 6 months, medications are usually not called for. That said, pharmaceuticals can be helpful when the depressive symptoms are extreme. So extreme anxiety and depression, suicidal ideation, these might come with pharmaceuticals, but it should be noted that pharmaceuticals are always given in addition to some kind of therapy. Adjustment disorders are relatively common, and there's no surefire way to prevent them in our loved ones. The DSM-5 states that between 5 and 20% of those in outpatient mental health treatment can be diagnosed with adjustment disorder. This is even higher in inpatient settings. The diagnosis is closer to about 50%. Early detection is the best prevention that we have. As for the prognosis, if symptoms last for more than 6 months after the stressor event, then a different diagnosis might be given, like depression. I want to talk a little bit about resilience. So this is the psychological quality that allows some people to overcome trauma and all of the adversities of life. Rather than letting difficulties and events and failure overcome them and drain their resolve, highly resilient people find a way to change course, emotionally heal, and continue moving toward a goal. A short-term adjustment disorder is not a failure, it's just a speed bump. And this is the outlook that people who are resilient have. So the qualities that promote resilience are finding ways to keep a positive attitude, cultivating optimism and hope for the future, the ability to regulate emotions, which is partly innate but can be bolstered with therapy guidance and support, and the ability to see failure as growth or a form of helpful feedback in life. I'm going to share with you some information about a Sage Scientific Journal study that I read that explored how the COVID pandemic might have increased adjustment disorder in the population. So they gathered evidence that said that the stress evoked by the pandemic triggered a greater amount of death awareness and death anxiety in the population. In short, the pandemic was traumatizing. The inevitability of death, as well as perceived lack of control surrounding death and its circumstances, might have led individuals to seek out more information about COVID, but this may have been like a positive feedback loop where then they were just giving themselves more of a scare. So death anxiety is a serious stressor affecting one's cognitions and behaviors. Researchers found the heightened fear of contagion to be a factor in hypochondriasis symptoms, meaning people felt sick when they weren't, and all of this led to just more maladaptive reactions in the population. Here's a quote from the CPI, or Crisis Prevention Institute. They said, "Today's educators are managing more anxiety and trauma-induced behaviors in students than ever before, while simultaneously addressing learning loss created by the pandemic's inconsistent learning environments." So these are just a few guidelines for helping children experiencing trauma in the classroom. One is use a calm, empathetic tone. Don't take disrespect seriously or personally. You can downplay it, right? We learned this as part of therapeutic crisis intervention. Set clear, reasonable limits in the classroom and make them enforceable. Take care of your own mental well-being and find a healthy outlet for your own stress and emotions. Remember the integrated experience. Our behavior and emotions influence others. Practice de-escalation strategies and how to help kids co-regulate, and give your students positive attention for desirable behaviors. Create a predictable and comforting environment. And lastly, acknowledge that you see their struggle and ask if there's anything you can do to help. I hope that this has been informative.